Hello, I'm Dr. Matthew Mintz, and I'm excited to share something new that I've added to my practice, my Dementia and Alzheimer's Prevention and Reversal Program. If you're concerned about your memory, worried about a loved one, or simply interested in protecting your brain as you age, I want you to know something very important. Memory loss is not necessarily a normal part of aging. For years, physicians, myself included, have told patients that cognitive decline is simply something that happens as we get older, and there isn't much we can do about it. That belief has left countless patients and their families feeling frightened, frustrated, and hopeless. However, today we know so much more than we did even just a few years ago. Having spent nearly 3 decades practicing internal medicine, the first 20 as faculty at the George Washington University School of Medicine, and then more recently starting my own practice in Rockville, I recently began to notice that I was seeing more and more patients with complex chronic illnesses. Conditions like long COVID, chronic fatigue syndrome, Lyme disease, and other chronic health problems. I also became frustrated that the conventional medicine that I had been practicing for years often didn't help these patients get better. Many of these patients had seen multiple specialists. They'd been given diagnosis, medications, sometimes told there was nothing more that can be done, yet they were still suffering. That is when I discovered functional medicine. Functional medicine asks a completely different set of questions. Instead of simply asking, what disease does this person have, or what lab test is positive, it wants to know, why is this person sick in the first place? Rather than focusing solely on symptoms, functional medicine looks for root causes. We examine how nutrition, sleep, exercise, hormones, inflammation, toxins, infection, gut health, stress, genetics, and other factors interact to affect overall health. And nowhere is this approach more important than when it comes to brain health. Now, traditionally, Alzheimer's disease and dementia have been viewed as a disease that slowly and inevitably progress over time. While newer medications may help slow this decline in some patients, they really haven't demonstrated the ability to restore memory and often come with significant costs and very serious side effects. Now, what changed my perspective was a recent groundbreaking study called the Avanthia trial. This was the first randomized controlled trial to demonstrate actual improvement in memory and cognitive function using a functional medicine approach rather than just a single medication. In this study, approximately 92% of participants improved. The program addressed factors such as inflammation, insulin resistance, hormone imbalances, nutritional deficiencies, toxins, infections, sleep problems, and other contributors to cognitive decline. Now, patients didn't just stabilize, they actually improved. When I reviewed this study, I realized that this approach fit perfectly with the functional medicine principles I'd already been using successfully with patients in my practice who were suffering from other complex conditions. That's why I decided to bring this program to my practice. Now, the program has two phases. The first phase is what I call the comprehensive cognitive health assessment. This is one of the most detailed evaluations of brain health available. We perform extensive testing to look for the many factors that can contribute to cognitive decline. This includes metabolic issues, inflammation, infections, toxins, hormone imbalances, sleep disorders, nutritional deficiencies, gut health problems, oral health issues, hearing and vision concerns, and more. We also perform detailed cognitive testing and advanced brain imaging assessments to better understand exactly how your brain is functioning today. Once all of the testing is complete, I will meet with you personally to review these findings and create a customized plan. Now, the second phase is the Personalized Cognitive Restoration Program. This is a 9-month program tailored to the customized plan created from the Cognitive Health Assessment. This is designed to help optimize your brain health and address the factors that may be driving cognitive decline. Recommendations can include dietary changes, exercise programs, sleep optimization, stress reduction, brain training exercises, treatment of infections, reducing toxic exposures, and correcting nutritional deficiencies. It also includes hormone optimization when appropriate, as well as targeted supplements that have shown to support brain health. We also provide ongoing support, coaching resources, and regular follow-up visits to help you stay on track. Now, what excites me most about this program is not just the science behind it, but it's the hope. I have seen firsthand how devastating memory loss can be, not only for patients, but their spouses, children, entire families. The fear of losing your memory, your independence, or your ability to recognize the people you love is one of the greatest fears many of us have. The good news is that we are no longer limited to simply waiting and watching. Today, we have tools that can help identify risk factors earlier, protect brain function, and in many cases, improve cognitive health. Now, if you'd like to learn more or know someone that might, I invite you to visit my website or schedule a free meet and greet consultation. During that visit, I'll explain the program in a little bit more detail, answer your questions, and help determine whether this approach may be right for you or someone you love. Now, thank you for watching this video, and I look forward to helping you achieve your healthiest brain possible.